Frankly, I'm exhausted, as I think most of us are, both physically and emotionally.
That is an emergency room physician right here in Arizona. As we head into this holiday weekend, he is preparing for another overnight shift amid the coronavirus pandemic. Our Whitney Clark shares his experiences in the ER and his message.
Dr. Bradley Dreyfus has been living in an Airbnb in Tucson for about 3 months, away from his wife and daughter, so he can treat other families.
Last week there was a family where the third person in the family was intubated and on a ventilator. Yeah, I don't know what to say. Like, everyone's just emotionally and physically exhausted, and we don't see an end in sight.
The doctor penned his feelings in a recent New York Times piece titled, "I'm a healthcare worker. You need to know how close we are to breaking." He says about half of their ER visits are specifically COVID-19 patients or suspected cases. Those patients are alone, and the doctors in full PPE.
They're gasping for breath, and there's not much you can do besides eventually intubate them, and you don't know if they're going to wake up again, and trying to explain that to family over the phone, it's really challenging.
To help cope with the mental stress and anxiety, there's a group called HCW Hosted, which recently formed and connects frontline workers with safe housing, emotional support, childcare, and more.
One of my colleagues yesterday, sorry, I'll tear up, just broke down because she's scared to go see her family, and that's because we know we're the high-risk folks, right? Like, we're the highest risk. There's tons of stigma around that.
He has concerns about the coming months and the stress of flu season on the hospital system. Dr. Dreyfus says if we care about the future and to be competitive on a regional and global stage, we need to take care of ourselves.
We need to mask up. We need to physically distance. We may even need to shut down again. But that's for the good of our economy.
For Arizona's Family, I'm Whitney Clark.